If you're over 60, what I'm about to share could save your life or the life of someone you love. Most people believe strokes strike without warning. One moment you're fine, the next everything changes. But after decades of working with older adults, I can tell you the truth is far more unsettling. Strokes often build up silently, and the most dangerous risks might be hiding in your daily routine. What if I told you that the very pill you take each morning, maybe even the one your doctor once recommended, is quietly increasing your stroke risk while you sleep? As a neurologist who has spent years listening to patients and walking them through recovery, sometimes heartbreakingly incomplete, I've seen a pattern too few people talk about. Seniors who follow their routines faithfully, seniors who believe they're doing everything right. But something subtle is working against them, especially between midnight and sunrise. In this video, I'll walk you through 7 hidden medication habits, including the most common pill in your cabinet that can quietly damage the brain's most fragile blood vessels. These aren't urban myths, they're backed by medical research and real-world cases I see every week. Please stay with me to the very end, because the last habit may be the one you're doing right now. And that one small change could protect your memory, your independence, even your life. The hidden risk of common OTC pain relievers, NSAIDs. Let me ask you something simple. How often do you reach for a pill when your back aches or your knees flare up? Ibuprofen, naproxen, maybe it's Advil or Aleve. They're in almost every household, often described as safe, gentle, non-prescription. And for years, many of my patients over 60 have taken them without a second thought. But here's what they didn't know, and what I want you to understand before it's too late. These common pain relievers belong to a group of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. While they can ease pain and reduce swelling, they also constrict your blood vessels, raise fluid retention, and interfere with kidney function. And for older adults, that's a dangerous mix. Here's the part that keeps me up at night. NSAIDs can significantly raise your blood pressure, often while you sleep. Why does that matter? Because most strokes in older adults happen in the early morning hours, right when your blood pressure naturally spikes. Now imagine adding a pill that tightens your blood vessels and puts even more pressure on aging, fragile arteries. You won't feel a warning. There's no chest pain, no dizziness, just one silent rupture deep in the brain, and everything changes. I've cared for patients who took NSAIDs for years, thinking they were doing the right thing. Then one morning, they couldn't move one side of their body, or they opened their mouth and no words came out. They were smart, thoughtful, careful people, but no one had ever warned them. And here's the twist. Even if you've never had high blood pressure, regular NSAID use, especially without your doctor's guidance, can still tip the scales. And if you're already on medications for your heart or blood pressure, NSAIDs can create a chemical tug-of-war inside your body. Your brain ends up caught in the middle. This isn't about fear. It's about being informed. Just because something is sold over the counter doesn't mean it's harmless, especially not for seniors. So what should you do? Don't self-medicate. Always check with your doctor before taking NSAIDs regularly. Look for alternatives to manage chronic pain like gentle movement therapy, heat, or magnesium. And track your blood pressure, especially in the morning, because the real cost of ignoring this advice isn't just a headache. It could be your ability to walk, to speak, to remember who you are. It could be your life. Let's be smarter. Let's protect the brain that's carried you through life. The next section covers another everyday pill, one that's even more widely used and potentially just as dangerous without proper guidance. Ready to continue? 2. Taking aspirin without doctor supervision. For years, aspirin was seen as a wonder drug, a tiny, inexpensive pill with a big promise: protection from heart attacks and strokes. Maybe you've heard it from a neighbor. Maybe even a doctor years ago told you it was good insurance. But here's what I want you to hear now, especially if you're over 60. Taking aspirin daily without your doctor's supervision may actually increase your risk of a stroke. Yes, aspirin does thin the blood, and yes, for some people, particularly those with a history of heart attack, stroke, or diagnosed heart disease, low-dose aspirin is still prescribed. But here's the danger most people never hear about. As we age, our blood vessels, especially in the brain, become more fragile. Thinning the blood in a system that's already delicate can create the perfect conditions for bleeding. Not just the nosebleed or bruise, but a bleed inside the brain. These are called hemorrhagic strokes, and they often come without warning. I've treated patients who took aspirin faithfully, thinking they were doing the right thing. Some had no major medical history, just a belief that a daily aspirin was a smart habit. But their blood became too thin. One small silent leak in the brain turned into a catastrophic event. Worse yet, many people unknowingly double their bleeding risk. They mix aspirin with other blood thinners like warfarin or supplements like fish oil, turmeric, or vitamin E, all of which can make bleeding more likely. The body doesn't get a chance to clot, and the brain pays the price. You won't feel this happening. There's no early symptom, no red flag. Just one quiet moment that becomes a life-altering emergency. That's why the American Heart Association now urges extreme caution when it comes to aspirin use in older adults. If you don't have a personal history of cardiovascular disease, the risks may outweigh the benefits. So what should you do? Never start aspirin on your own, even if it's just baby aspirin, even if your friend swears by it. Ask your doctor if it's right for your specific health history. And if you're already taking it, review your full list of supplements and medications, because combinations matter more than you think. You deserve better than outdated advice or casual guesses, because this isn't just about one small pill. It's about your ability to stay independent, stay connected, and stay you. And that brings us to the next danger, one that has nothing to do with what you take and everything to do with when you take it. 3. Skipping your evening medications or taking them at the wrong time. Let's talk about something most people overlook: timing. You may be taking the right medication, the correct dose, prescribed by your doctor, but if you're taking it at the wrong time, or skipping doses altogether, you could be leaving your brain vulnerable when it needs protection the most. Here's what many seniors don't realize. Your body follows a rhythm, a biological clock, and every morning, usually between 4 a.m. and 10 a.m., your blood pressure naturally begins to rise. This morning surge is your body's way of preparing to wake up. For younger people, this rise is no big deal. But for those over 60, especially with high blood pressure or heart issues, this surge can be dangerously sharp. And if your protective medications, like blood pressure pills or cholesterol-lowering statins, have worn off by then, your brain is unguarded. The risk of stroke rises sharply, often without warning. I've seen it too many times. Patients who forgot their evening dose, or took it too early in the day thinking it doesn't matter as long as I take it. But it does matter. If your medication is meant to control your blood pressure overnight, and you take it in the afternoon or miss it entirely, you may be wide open to that early morning spike, right when most strokes occur. Some people even try to catch up by doubling their dose in the morning. That can be just as dangerous. Too much at once can cause a sudden drop in blood pressure, leading to fainting, poor circulation to the brain, or even another kind of stroke from low oxygen levels. The damage doesn't always show up immediately. It might be subtle: dizziness, morning confusion, difficulty focusing, or feeling off balance. But over time, these small things can lead to a big event: a stroke, a fall, or a blackout. So, what can you do? Set a consistent schedule. Use a pill organizer or set alarms on your phone. Ask your doctor, should any of my medications be taken at night to protect me in the morning? Never guess. Timing is not just convenience, it's strategy, it's protection. Because strokes don't wait for convenient moments. They strike when defenses are down. And for many people, that moment is just before sunrise. Remember, the clock is always ticking, but with the right timing, you can stay one step ahead. In the next section, we'll talk about a mistake that's becoming more common, especially among well-meaning seniors trying to stay healthy, and how it could be quietly increasing your stroke risk from inside your very own supplement drawer.
4. Mixing supplements and medications without knowing the risks. Let me be honest with you. Just because something is labeled natural doesn't mean it's harmless, especially when combined with your medications. Today, many older adults take supplements alongside their prescriptions: fish oil for the heart, turmeric for inflammation, magnesium for sleep, ginkgo biloba for memory. I understand why. It feels like you're doing something positive for your body. But I've seen firsthand how this combination, though well-intentioned, can quietly create dangerous interactions that raise your stroke risk. Here's the truth. As we get older, the body becomes more sensitive. The liver works slower. The kidneys filter less efficiently. And the brain's blood vessels? They're thinner, more fragile, less forgiving than they were 20 years ago. Now imagine taking aspirin to prevent clots and adding fish oil or turmeric, both of which also thin the blood. You might think you're doubling the benefit. In reality, you could be doubling the danger. I had a patient in her early 70s, sharp, active, thoughtful. She took low-dose aspirin, fish oil, turmeric, and ginkgo biloba daily, all recommended by friends. Then one morning, she woke up unable to move her right arm or speak. A brain bleed, not from trauma, but from over-thinned blood vessels that had quietly given way overnight. These interactions aren't rare. They're just rarely talked about. For example, ginkgo biloba plus blood thinners equals increased risk of brain bleeding. Turmeric plus cholesterol meds equals altered liver processing, leading to toxic levels. Magnesium or calcium with thyroid meds equals reduced absorption, less effectiveness. And here's the most dangerous part. There are no early warning signs. No pain, no fever, no clear signal. You simply take the pills, you go to bed. Then one day, everything changes. So what should you do? Tell your doctor about everything you're taking: prescriptions, supplements, teas, even vitamins. Bring the bottles to your appointment. Let your care team check for interactions. And don't rely on Dr. Google or advice from friends who mean well but may not know your unique medical needs. You deserve care that's tailored, not guessed. Because your brain isn't just another organ. It's you, your memories, your independence, your voice. Don't let an unspoken mix of well-meaning pills silence it. In the next section, we'll talk about something even more common, a habit that feels innocent, even comforting, but taken at the wrong time could be silently starving your brain of oxygen while you sleep.
5. Taking sleep aids that affect brain oxygen. It's 2 a.m. You've been lying awake for hours. Your legs ache, your thoughts won't settle, and all you want is a little peace. So, you do what millions of Americans do. You reach for that familiar nighttime pill. Maybe it's a PM pain reliever. Maybe it's something over the counter with a calming name. It works fast. You fall asleep. Problem solved, right? Not quite. Because here's what most people don't realize. Some of the most common sleep aids may be quietly depriving your brain of oxygen while you sleep. Many of these medications, especially those labeled as nighttime formulas, contain antihistamines like diphenhydramine. You might recognize that from Benadryl. These ingredients don't just make you sleepy. They suppress the nervous system, including the very signals that regulate breathing during the night. If you're living with sleep apnea, COPD, heart failure, or just normal age-related breathing changes, these medications can slow your breath to the point that your brain doesn't get the oxygen it needs. You might not even notice. You may wake up groggy and think, it was just a rough night. But inside your brain, the damage could already be happening. I once cared for a man in his late 60s. He took a PM sleep aid every night. Just one pill, nothing heavy. Over time, he noticed his balance wasn't quite right in the mornings. He felt foggy, unsteady. Then, one morning, he couldn't form a sentence. A silent stroke. Not from trauma, not from high blood pressure, but likely from low oxygen levels during sleep, night after night. And that's not the only risk. Studies show that long-term use of sleep medications in older adults is linked to higher risks of cognitive decline, falls, and strokes. Even those labeled non-habit-forming can affect your brain's delicate nighttime chemistry. They may help you sleep, but at the cost of alertness, reaction time, and blood flow the next day. And over time, those small deficits can add up to something irreversible. So, what can you do? First, talk to your doctor. If you're struggling with sleep, you deserve a solution tailored to your body, not just a quick fix. Explore safer sleep strategies, light therapy, breathing exercises, consistent evening routines, or melatonin under medical guidance. And above all, listen to your body. Waking up groggy, confused, or dizzy is not normal. It's a signal. Because real rest shouldn't come at the cost of brain health. And a peaceful night's sleep should never quietly lead you closer to a stroke. In the next section, we'll look at one tiny habit, something so small you might overlook it entirely. But skipping this one simple action in the morning can quietly push your blood toward danger.
6. Not drinking water before taking medications. It sounds so simple, so small. You wake up, you reach for your morning pill box, and maybe, just maybe, you swallow your medications with a single sip, or nothing at all. But here's what I want you to understand. That missing glass of water could be put in your brain at serious risk. especially in the hours after you wake. You see, after 7 or 8 hours of sleep, your body is naturally dehydrated. Your blood becomes thicker, more concentrated. That makes it harder for your heart to pump and harder for oxygen to reach your brain, especially if you're over 60, when circulation is already slower and blood vessels are less flexible. Now, picture this. You take your morning blood pressure pill or your cholesterol med without water. Your blood is still thick. Your stomach is dry. Not only will the pill absorb poorly, it may also irritate your esophagus or stomach lining. And worse, it may not even work properly when your body needs it most, during that dangerous morning blood pressure surge. Some of my patients have told me, "Doc, I've been doing that for years. Just pop the pill and go." But then they started having morning dizziness, weakness, foggy thinking. One woman even had a mini stroke just 30 minutes after waking. We traced it back to a combination of dehydration, diuretics, and skipping her morning water. Let me say this clearly. Dehydration is a known risk factor for stroke. It can lower blood volume, increase clot formation, and cause sudden drops or spikes in blood pressure. All of that puts tremendous strain on your brain right at the start of your day. And don't forget, many seniors take diuretics, water pills for heart failure or high blood pressure. That means your body is already losing extra fluids. If you're not replacing them, you're starting every day in a deficit. So what should you do? Drink a full glass of room temperature water first thing each morning, ideally before taking any pills. Avoid coffee as your first fluid. It's dehydrating. If you're taking multiple medications, space them with water and give your body time to absorb them gently. It's not just hydration, it's protection. That morning glass of water is like a cushion for your heart and brain, a simple shield that costs you nothing but gives you everything. Because the difference between a steady morning and a life-changing event could be just one glass of water. Next, we'll talk about something many of us do without question, taking multiple pills daily without tracking how they interact. And it could be the most silent, most dangerous risk of them all.
7. Taking multiple pills without tracking side effects. If you're like many older adults I've worked with, your day probably starts and ends with a pill box. A tablet for blood pressure, one for cholesterol, maybe something for sleep, digestion, pain, or joints. Then there's your multivitamin, a calcium supplement, maybe some fish oil. Over time, your medicine cabinet becomes a small pharmacy. And here's the hard truth I need you to hear. The more medications and supplements you take, the greater the risk. Not from any one pill, but from how they all interact. This is what we call polypharmacy, taking multiple medications at once. It's common. In fact, most Americans over 65 are on at least 5 medications. Many take 10 or more. Now, each of those pills might be prescribed with good intentions, but your body, especially as it ages, can't process them the way it used to. Your liver doesn't clear drugs as quickly, your kidneys work harder to filter, and your brain? It becomes more sensitive to even small chemical shifts in blood pressure, hydration, and oxygen. I once had a patient, a thoughtful, well-organized man in his 70s, who came in after a frightening fall. No stroke, no heart attack, but he had suddenly blacked out while brushing his teeth. We reviewed everything. He was on 3 blood pressure medications, including a diuretic. He also took a sleep aid, magnesium, and turmeric. No one had checked how those pills were interacting together. The result? His blood pressure dipped too low in the morning, his brain didn't get enough oxygen, and he fainted. He could have hit his head, broken a hip, lost his independence, or worse. And what shocked him most was this: all the pills were prescribed. None were wrong on their own. But together, in one aging body, they became a recipe for disaster. So here's what I recommend. Keep a written list of every pill you take: prescriptions, supplements, vitamins, even occasional ones. Watch for changes in how you feel: dizziness, foggy thinking, slurred speech, shaking, fatigue. These are not just getting older. They could be signs of interaction. Use a medication tracker or app and bring your full list to every doctor visit. Don't assume your doctor knows what your other specialists or pharmacists have prescribed. Remember, your brain is not just managing your thoughts, it's managing your chemistry, and too much unmonitored input can overwhelm it. You don't need to be afraid of your medications, but you do need to be informed, aware, and in control. Because the greatest risk isn't always what you take, it's what you don't notice until it's too late. And now that we've walked through these 7 hidden risks, it's time to connect the dots. Because the scariest part isn't any one pill or habit. It's the way they quietly build on each other until one day something breaks. Let's talk about the truth behind strokes and how they really happen.
Your brain has carried your memories, your voice, your strength for decades. Now it's your turn to protect it. One small habit at a time. One smarter morning at a time. If this message spoke to you, share it with someone you care about. And if you're ready to stay sharp, strong, and independent, hit subscribe and join us on this journey. Because your best years aren't behind you. They're just beginning.